AMERSA supports our community because we can take lessons learned from other communities that have been doing this sort of interprofessional and multidisciplinary approach much longer than we have. And so I actually remember going to my very first AMERSA conference and walking through the poster session and just meeting all of these like-minded individuals who had been, again, doing this work so much longer than we have, and learning so much from them, and then taking that knowledge back. At the time, we were starting a buprenorphine initiation program. And of course, there were so many people who had done this before, and I was able to learn how, in our case, we were developing a system for transitioning patients from the hospital to the community, linkage essentially, and we were new to this. And of course, AMERSA has so many people, physicians and pharmacists and nurses and social workers who have been, fine-tuning the art of linkage for several years. And so we were able to meet some of those individuals, learn from their experiences, and apply them to our own community. And we've done that similarly with projects around alcohol use disorder, projects around naloxone distribution, and so much more.
AMERSA has been involved in a number of national activities that I think have changed the field. We were, as an organization, we participated in supporting the parity law so that substance use disorders would be dealt with in the same way as other medical conditions. We knew that the opioid epidemic was coming years before it was in the national consciousness, and we were able to begin to prepare for that. We have supported needle exchange programs. We've been pushing for prevention efforts at a time when prevention really took a back seat to treatment. So we've been on the forefront of a lot of national efforts. And I think it's a reason why I keep coming back to AMERSA, because I feel that the organization has its finger on the pulse of what's happening nationally.
Learning that we need to insert education and curriculum with addiction in mind has become really impactful in the community I serve, which is the students, the physician assistant students here at Mercer. By using the resources and the knowledge from AMERSA, I've been able to write grants, and actually we were able to land a supplemental grant through HRSA and send the students into clinics practicing MAT with physicians that were treating substance use disorder. So that, as an extension of what was happening here in our curriculum, went out further into our community, is now impacting clinics in our community with students well-versed in MAT training, which is very exciting.
It really is patient-focused. So every initiative, every group that I've been involved in, the emails that I receive really are all catered to how can we improve the lives of patients that have addiction or substance use disorders? How can we better treatment? How can we better access models or models of care? How can we improve the quality of life of patients?